I would like to ask you both permission to use this video for educational purpose. Would I have your permission?
Yes.
Yes? Okay. Now, at first I'm going to just turn around. You have a 1-level spondylolisthesis. We call that spondylolisthesis, and this is the MRI I'm going to put back up here, which is practically causing quite significant stenosis in the second disc from below, and you have very typical textbook symptoms from that. So it's nothing unusual about your situation. You told me about your previous experience, and without naming the name of the doctors, can you tell me what you have been told?
I was told by the first spine center doctor that I had 3 measures in which to handle this problem.
Mm-hmm.
One was therapy, the next was epidurals or surgery, and then I was referred to a surgeon in the Mayo.
Okay.
And he took a look at it and he said, "You would need a fusion." And I says, "I really don't want." He says, "I'll be looking around." And he says, "You'll be seeing me." And from there I went to...
No, but he told you about that, what kind of surgery, and specific about the surgery. Did he tell you anything about that?
He just says you'd have to do a fusion.
Okay.
And he did not go further on that, and
Okay.
just told me the length of the surgery.
What did he tell you about the length of the surgery?
It's 8 hours.
He told you for that 1-level fusion L4-5, that would be an 8-hour surgery.
From what he saw on my imaging,
Mm-hmm.
he told me it'd be about an 8-hour surgery.
Got it. And then you saw another doctor in the
Yes.
same place.
I was looking for something less severe, and the next one suggested or prescribed a laminectomy.
A laminectomy
Yes.
for spondylolisthesis.
Yes.
Got it. And did he explain to you what that means, and how
Yes.
long it takes, how long stay in the hospital, and so on?
I think he said it was about 4 hours,
4-hour surgery.
and he would remove a small bit of the lamina.
Mm-hmm, mm-hmm. Well, laminectomy by definition is removing the back part of the
Yes.
bone.
That
that
was
is
not conveyed to me.
okay. And then how did you find me?
Sheer luck. I record the news at night and then pick out what stations I like to watch for what they're covering.
Okay.
And I was fast forwarding through the commercials,
Mm-hmm.
and my wife and I both said, "What's that?" It was something about spine. So I backed it up and read it, and that's where I found
Okay.
you.
Well, this surgery, I have done over 2,000 of this kind of surgery, and I have done over 3,000 of the other kind of surgery that they do for you. This surgery, routinely, we do it in under 1 hour. Our patients usually are discharged within 24 hours, 96% of them. Our blood loss is 1/10 of the open surgery. Our risk of infection is 1/15 of the open surgery. And we have been doing it for 12 years. So this is in my hand, in our system, it's not an 8-hour or 4-hour surgery.
Mm-hmm.
And we don't take the back of the bone off.
Yeah.
We keep it in place, but we restore the height and the alignment of the disc. So we restore it to the time you didn't have symptoms, so to say. So, well, thank you for sharing your experience with us, and I'm going to share this with my team here, because sometimes we forget what we do, because we do it routinely. And that becomes like and they think what we do is just the way it is done. It is not, as you just mentioned that.
Yeah.
Any other question or comment or anything?
Well, on this subject, I left surprised that was the only suggestions they had for my issue.
Yeah.
Something major.
Well, I'm happy you came over.
Yeah.
Thank you.